Is in session. We'll rise and say our Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This time, I'd like to call on the Township Health Officer, Larry Taltone, to provide us with his health officer's reports and any announcements that he may have.
Thank you, Mr. Chairman. At this time, I don't have any announcements. I'm not aware of any other board members calling in to say they would not be here, so I'm assuming that they will be. My report for the month of May of 2009, you'll notice that the number of food inspections are lower, whereas the number of bathing places have increased. This is the season that the seasonal summertime bathing pools open up for the season, and we have probably about 35 of them that open up for the season. This year it was a little bit more trying because of the Virginia Graham-Baker Act, which is an act that was arised from Secretary of State James Baker's granddaughter, who had died in a pool when she got caught in the drain. And as a result of that, the federal government has required that all pools, commercial pools, have protection, either new covers that prevent that from happening, or they're called anti-vortex covers, or a certain valve that will release when a person gets caught on those drains. So we had to do those inspections to make sure that the pools all complied, which took a lot more time. In addition, we have several complaints. Some are property maintenance, which were college students that had homes where the roofs were leaking in on the students. We had to deal with those issues. We had our normal rat complaints, high weeds, grass, and noxious growth. Also mice and the typical bats that we deal with on a routine. It seems like far too frequently anymore. Just bringing your attention to the some of the events that we've had. We just had the Mainline Jazz and Food Festival on Saturday. Unfortunately, it was a rain. We had a heavy downpour of rain, which was unfortunate during the past weekend. Bring your attention to the health alerts. As everyone is probably aware, we've had the swine flu that has been in the United States and around the world. Matter of fact, we're now at a level 6, which is determined by the World Health Organization, and it's determined by geographics, not so much the severity. But it is now a level 6. We did meet with Department of Environmental Protection regarding the West Nile program, and I'd like to just remind people that if there are anyone out there that has any kind of a allergic reaction to any chemicals that they think DEP may spray when they're treating the West Nile, we have the forms here at the township that they could fill out, and they can bring them back to me, and I can make sure that they get to the right agency. And when there's spraying or any kind of treatment that will happen in the area, they will be notified prior to that spraying. So we do have the forms here. They can come into the township building and pick them up, or they can contact me, 610-688-5600, and I'll be happy to make sure that they get it. So ends my report.
Thank you, Larry. Before I turn the meeting over to our president, Mark Bullock, I'd like to acknowledge the presence in the audience tonight of Andrea Chapego, the director of pupil personnel and counseling, and a number of other areas within the Radnor Township School District. Dr. Chapego is here to just observe the meeting tonight. Welcome.
Thank you very much. Len Donato, with regard to the West Nile spray, is that something that's been done before? Is there anything people really need to be concerned about, or is this pretty standard activity?
I feel like it's pretty standard activity. As far as West Nile goes, its spread has gone uniformly across the United States. It's always present, and I think doing what we can to help control it is going to be fine, and it will always be there, though. So this is fairly standard, the monitoring and fight against the mosquitoes.
And that would be in addition to folks making sure that they don't have stagnant water on their property, like in old tires or anything of that nature, right?
Yeah, in Radnor Township, I think one of the big places that we see a lot of mosquitoes breeding are in personal ponds and pools on the properties and flower pots. So we just have to keep in mind all these different sources. There's a lot of different treatments for water to make sure mosquitoes are not breeding in them. So just have to look into those. There's powders and pellets and even natural ways like frogs, and however you feel comfortable doing it just needs to be managed.
Great. Thank you very much. Any other questions for Larry on his report? Great, thank you. Are we up to old business or the minutes? Okay. All right, if we can all take a look at the minutes of the meeting of May 18. And as well as the, oh, that's right, okay. Yeah, they had been previously distributed, the March 16 and April 20 minutes. So I do not believe anyone presented any comments or questions at the last meeting, but I'll open up again for not only the May 18 minutes, but the March 16 and April 20 minutes, if anyone has any questions or comments related to those. And if not, I will ask for a motion to approve.
Mark, I have a correction to the minutes of the May 18th meeting.
Okay.
Under old business EAC update, it indicates that if I said what it says here, that I would only be able to do this to the end of the year. That's not quite correct.
Okay.
What I think I intend is that I would be able to evaluate that my commitments at the end of the year and report to you and the board as to whether or not I'm able to continue to do that.
Very good. Any other amendments, corrections, or additions to those minutes? Hearing none, I'll ask for a motion. Thank you. All in favor?
Aye.
The minutes of May 18 are approved as amended by Herb, and the minutes of March 16 and April 20 are approved as previously submitted to the board. Thank you. So now we can move to old business. And speaking of EAC,
Well, I did attend the last meeting, but there basically is not anything that need concern this board for this meeting. I've been, however, I should indicate that one of the things that, I don't know if Dr. Prescott did this, but the EAC has asked me to begin the process, which I did at the last meeting, of keeping them up to date as to what we're doing, and I did that with some items of mutual concern at the last meeting.
thank you very much. Any questions for Herb? Hearing none, let me move to the medical environment and healthcare access. And this I could essentially talk about this issue for hours on end because, as everyone is probably, I won't though. I know Len was getting concerned there for a minute. As much as I would like to, I won't. As everyone is probably very aware, both in Washington and in Harrisburg, right now there is significant debate and movement going on with regard to healthcare, especially issues around healthcare access. I would commend to folks the website for the Health, Education, Labor, and Pension Committee, which is the Senate committee charged with outlining the healthcare proposals. That's Senator Kennedy's committee. They are developing a proposal which will substantially revise the way that healthcare access is delivered in this country. On Wednesday, the Senate Finance Committee will be issuing its proposals, which will include how to pay for expansion of health insurance. That could include things such as taxing of health benefits, which heretofore have not been subject to federal income tax. There are other proposals on the table with regard to how to finance the proposed reforms. So it is going to be a significant couple of months at the federal level. Having been in healthcare, at least on the minute, my brother is a physician, and he reminds me that he's in medicine and I'm in healthcare because I work as a healthcare administrator. This is probably the most significant movement to healthcare reform in 20 years. And it's more, I would say it's more likely than not that something will be passed. Some very significant issues which could impact the way we all receive health care. Focus on health insurance and whether or not the concept of a public option, essentially creating a public health plan, will be adopted. That is probably, in addition to the financing aspects of it, the most crucial aspect of the debate in Washington right now. The proponents of that believe that it presents an option to the almost 13,000 health insurance companies we have in this country. Critics would argue, why do you need another option if you've already got 13,000 health plans? Critics believe that this is kind of the camel's nose under the tent, that ultimately the way the insurance market works is that a public plan would essentially drive out the private plans because the businesses who provide insurance for their employees will essentially say, why do I deal with this by myself? Why not just have the government do it through a public plan? So it is probably the most significant portion of the debate going on right now. The other aspect of the debate is the fact that the price tag for health reform is upwards of $1.2 trillion, and how to pay for that is going to be the significant issue. It's more than likely that there'll be some type of tax increase. It almost has to be. You couldn't come up with those dollars without something like that. Issues around, do you tax employee benefits? That's going to be a key issue. So it is absolutely momentous what's going on in Washington right now. Folks should really, I would recommend all of these various websites, both at the Senate Finance Committee. They published 3 documents regarding aspects of healthcare reform and healthcare finance. And people, if they have a concern, should call their congressman regarding this, because this is going to be potentially very significant. At the state level, the governor just introduced or updated his numbers with regard to the state budget deficit, which is now upwards of $3 billion at the state level. That is most significant to the Medicaid program. Interestingly enough, the Medicaid program is probably the largest deliverer of health care in the state. 1 out of every 6 or 5 people in the state is covered by Medicaid. Medicaid is not just the insurer for those among us who are poor, but it's also insurer for those who have significant disabilities. It is a tremendously large program, and any revisions or adjustment to the Medicaid program has significant impact on the delivery of health care. The debate in Harrisburg is how do we deal with the deficit? Unlike the federal government, which can float debt and be in a negative situation from their budget, the states are required to have a balanced budget. So there's some significant discussion about cutbacks to hospitals and providers and whatnot at the state level too. So folks, if they're also concerned about their healthcare system locally, should really begin to look at the state websites with regard to some of these budget proposals, because it could also be some very significant issues going on. So I could bore people again for hours on end, but I won't. If anybody has any questions, I can hopefully try and respond. Good. Hearing none, we'll move to Radnor Health Matters.
Thank you. For Radnor Health Matters, what I'd like to do, Mark, is to review the draft number 3, which was included with your packets in front of you tonight, and also the budget, as well as the memorandum of transmittal to the Township Commissioners. And I'll just really run through it as quickly as I can. Basically, the form of the draft is to comply with the Rite Aid Foundation's requirements, and so we have to indicate things like where we are in geographically, the population of the township, which the indicated numbers as of the census of 2000, and how many households we have in the township. We need to indicate who the contact person is, and what I'm suggesting in that part of it is that contacts be made through Larry Taltone, who can transmit any questions on to me, so that we're more certain of getting the questions and any information, follow-up information that way. We need to tell them when we would need the funding, and what the timeline is for beginning the project. And then something about what the project is about, which again basically is to provide for the printing and distribution of the Emergency Preparedness Guide, which we've reviewed at previous meetings. And then again, signatures would be the President of the Board of Commissioners and the President of the Board of Health. And we would have enclosures which would include the project budget. And let me just say a few words about that. The number of households doesn't have to be there. That's a mistake on my part in keeping that in there. There's a cost for printing the guides and the letters to accompany the guides, the postage costs, and the total funds that we are requesting amounts to $8,730. Let me say a word about the in-kind services, and the asterisk may not be entirely clear. It's my thought, and we don't necessarily have to go in that direction, but that In my experience, foundations usually like to see some level of commitment on the part of the grantee. And in this case, that commitment would be represented by what is usually called in-kind services. And I should indicate that that does not represent any additional expenditure to the township. It's the dollar value of providing clerical employees who are already on staff to do things like stuffing the envelopes, applying labels, and sealing the envelopes, and also actually physically taking it to the post office. But this would be done again by existing township staff, so it wouldn't be outsourced or anything else. And let me parenthetically say that I'm indebted to Amy Cuthbertson, the township's finance director, for providing the hourly rate, which I've multiplied out on an estimate of how long it might take to actually do that work. I had provided a draft of the memo of transmittal, and that's the next thing in your packet, and then Mark, and I fully accept his amendments, had amended that, which is the last of the draft documents that you have. And with that, I'm open to any questions or comments.
Herb, I think it might be helpful from what you're saying to just add in the word existing between providing and clerical, so to say providing existing clerical employees. And then up above, you have envelopes printing and letter printing, but you don't have guide printing? Or is the letter printing the emergency guide?
One of those two includes the guide printing.
So maybe just make that
I'm sorry,
explicit.
yeah, I have to change some of those headings. There's.
And thank you very much for doing all this. I
Yeah.
think it's really terrific, and I think just the, very minor changes, and you said Mark Bullock had some minor changes as well, so looks good.
Basically, unless there were other changes that Mark had, they were to the memo of transmittal to the township commissioners. And that's the last document in your materials in front of you.
Any other questions or comments for Herb? Again, thank you for taking the lead on this. Obviously, very important. And as the, I guess, now determined pandemic of H1N1 indicates, that the emergency preparedness is not just related to the unthinkable events of September 11, but also to issues that come across related to broader issues of health. So I think it's a very worthwhile and important information that we can get out to the community.
Mark, I'm not clear on this as to whether or not we need a vote. And I should point out that depending on the timing, we'll have to, once this is approved to go forward from here to transmit it to the township commissioners, we would have to, of course, put all of this on letterhead and all that and get you to sign off on your memo.
John, if your thoughts on whether or not we need a vote, or is this just something that we can now send forward?
I think you might as well vote on it just to be sure. I don't think you need to, but it can't hurt. So.
There you go. Very good. So if I could have a motion to so move. Good. A second? All in favor?
Aye.
All right. So the motion passes. The enclosure material, as well as the draft letter requesting the grant, will be sent to the Board of Commissioners with a recommendation that the board approve that, and hopefully we'll be successful in obtaining these grant funds.
Thank you.
If we can now move to the Radnor Flu Mist Clinic.
Well, Dr. Chapego, I'm particularly glad that you're here for this discussion. For the past couple of years, we have had clinics for a fee offering flu mist, which is the intranasal flu vaccine, just at the middle and the high school, public schools. And I know those are planned again for this coming year. In the past, I had been able to actually get commitments for free flu vaccine and free staff from Mainline Health to give it. So it actually could have been provided for free, but various bureaucratic snafus got in the way of making that possible. I think if that was something that the school district was interested in, I think a request coming from you to the Delaware County Health Department for the vaccine and some staff, and to Mainline Health for their community health branch, I think it certainly would be worth making the request. But I think in any case, particularly given what's happening with the novel influenza A, H1N1, also known as swine flu, we really want to make sure, and along with the fact that this is the first year that the Centers for Disease Control and Prevention, the American Academy of Pediatrics, and the American Academy of Family Physicians in their recommendations are recommending that all children ages 2 through 18 years of age get an annual flu vaccine. So that would be just the regular seasonal influenza. The novel influenza would be on top of that, a separate vaccine, and probably a shot, and maybe 2 doses, maybe 1 dose. But as I understand the issue, the adjuvant that is used that would make the difference between it being 1 dose and 2 doses is widely used in Europe, not approved here, and the FDA might not approve it in time, which would mean that we'd be using the 2-dose schedule. We would not have the advantage of this adjuvant. But anyway, so it's particularly important that at the very least we can promote, make sure parents are aware of this recommendation. All children 2 through 18 years of age get the annual flu vaccine. This is not part of the school requirements, so it's not a legal requirement in that sense, but it is a recommendation. Part of the reason to offer the flu mist clinics in the past has been that pediatricians and family physicians, to implement this regulation, this recommendation, are really taxed to provide. If you're a pediatric practice, it means every single one of your patients needs this vaccine, and if you're under 8 years old and getting it for the first time, you need 2 doses. So it's just logistically tremendously difficult. It's not something that our local providers are possessive about, unlike some other vaccines where you might be facing some resistance to offering it in school. But I think that if parents can really be informed about it, I did go to I offered to speak both with the middle school PTO and high school PTO. The high school PTO took me up on it. I did meet with them and went over both the upcoming changes in school regulations as well as the issues around influenza. I'll probably make a similar offer in the fall. It would be really terrific to extend this to the elementary school. The elementary school children are even more vectors than the middle and high school ones, where it was really kind of a logistical issue that we sort of worked with the middle and high schools, that there's no one in that group that would need 2 doses of vaccine, and just the whole thing with the permission, and it just seemed it was a little more manageable. But nonetheless, in terms of the risk, the elementary school kids are at greater risk and are at greater risk of spreading it. In Pennsylvania this year, we have had a death to a 15-year-old in Franklin County who lost his permission slip for his school flu clinic. Previously healthy kid, died from flu vaccine. Died from influenza, not from the flu vaccine, excuse me. There are no known deaths from flu vaccine, in fact. But so I think that it really is incumbent upon us to make people aware of the recommendations and of the different options of places to get flu vaccine, certainly from their private provider. I know private providers are certainly going to be expanding their ability to administer vaccine this year. They're going to be doing a lot more flu clinics, Saturday clinics, evening clinics that'll be, flu vaccine only. I think, however, as schools, we do have a role to play, and I think it'd be great if we can be part of the solution here. So, and I would be more than happy to, there's terrific handouts. The CDC.flu website has great handouts that are ready to go for parents, for teachers, for children, for, PSAs, things that could be on the school announcements. There's lots of resources that are, really ready to go. So, and if there's anything at all I could do, I'd be more than happy to work with you on it.
Thank you very much, Amy. And Doctor, is there anything that you'd like to say, or you're more than welcome to come up and use the microphone?
Thank you for the offer to come and talk to the PTOs. I think that's really a great idea. We are fortunate now at Radnor, the school district, to have sort of redone our website, and our method of getting information to parents is now through what's called e-minders. So the ability to communicate now has really been improved. I see, if you don't mind working with me soon, we could really start right at the beginning of the school year to get the information out, and I'll get the names of the people I need to get in touch with. I do think that people are going to be much more willing to take advantage of this year than they have been in the past. So anything that you can do to help, I think it's really good if we work together. So thank you for that offer. I appreciate it.
And thank you, Doctor, for all that you do and all that the district does for our children in the district here. Appreciate it very much. We have some new business, if there's nothing else on the old business. And then, Larry, I had some questions on this great material you sent from the National Association, so perhaps we can do our quarantine hearing first and then go to that. Does that make sense? Great.
Fine.
Why don't you introduce it, Larry?
Mr. Chairman, board members, we have Mrs. Susan Perez. She resides at 215 Pembroke. She has a cat by the name of Alley Cat, who suffered a wound of unknown origin. Alley Cat is currently residing at a local veterinary hospital as required by code. Mrs. Perez is here today to petition this board for permission to home quarantine. I did go out and visit the property. If this board does approve, Alley Cat, I think, will be quarantined in a safe environment, and she's here to talk to you and plead her case.
Great, thank you. You want to come up? Very official, I know.
Well, Larry pretty much summed it up. Allie was had slipped out in the morning and something attacked her. We brought her to the vets and couldn't tell what it was. She was a little overdue for her rabies shots, so she still is in the vets, and we'd like to have her home. So we have a room that's locked down in the basement, and the basement can also be locked. Larry came over and inspected it. My husband said he'll be the primary caregiver. And anything else you'd like to know?
Great. Any other questions?
How much time is left on the quarantine?
Better part of 6 months.
Because it happened on May 22nd.
Do you have some arrangement for the summer if you're going away, or do you have?
Well, we'd put her back in quarantine.
Yeah, I would support Alley Cat being home.
Great. I'll take that as a motion. Do we have a second?
Second.
All in favor?
Aye.
Aye.
Aye. Great.
Okay, so
You
I
can bring her home.
go to the vets tomorrow?
Well, no, at this point, I need to see the collar that you're gonna put on Alley Cat, because if she gets loose, I wanna be able to make sure that she has that collar on her. So as soon as you get the collar, bring it in, then I'll give you something and Dr. Donato can release her.
Okay, and the collar has to have, what, a printed tag on it?
It has to have the tag. When I came by the house, I went through the 10 stipulations. One of the things was the collar. The collar has to have under quarantine, if found, contact Radnor Police and the phone number.
Oh, okay. Okay.
But as soon as you get that collar, bring it to me.
And Larry, where does she get
Where
that?
do I get that?
She can get anywhere. She can put it on one of the rabies tags, you know, the metal tags. She can write it on that and put it on a collar.
I think we've used medical bracelets in the past, too.
That's what I meant, the medical
Yeah,
bracelets.
even like we would wear in the hospital. I think we can,
Is that something that she has to get printed up, or is that
Yeah,
something
how do-
you?
Yeah, she has to get it.
Okay. But is
Do
it,
you have them at the vets?
I think we have a few that we can, yeah, we'll be able to get something together.
So I don't pick Ally up till I come back here and show you the printed up tag, or?
Yes, I need to see that tag. I can come there.
Pardon me?
I'll make myself available.
Okay,
Yeah, I don't want you to not have Ally a minute more than you have to.
okay.
But it has to be right before he comes out. I need
Okay.
to make sure we have the tag.
Okay.
All right.
well, then, subject to the showing of the badge, congratulations, and you'll have your cat back soon. Take
Thank
care.
you.
Thank you. Amy, you had a new item?
Yes. I just wanted to let the board know that I did have the meeting with the Boy Scouts on Saturday morning. I did have the meeting with the Boy Scouts on Saturday morning to help them earn their public health merit badge. And we talked about the several different health issues and the roles of different entities in dealing with them. So we, talked about how public health really should be science-based and yet also involve sort of ethics, politics, religious ideas, the role of government. And I divided them up into groups where they dealt with lead poisoning, foodborne illnesses, insect-borne illnesses, sexually transmitted diseases, and influenza, both influenza that has a vaccine for it and influenza that may not have a vaccine for it, and had them identify different preventive measures in terms of the agent, the host, and the environment to try and sort of get that approach that for any disease to be transmitted, you need a sufficiently virulent agent affecting a susceptible host in the proper environment, and to start thinking, okay, and that any time you can interrupt that triangle, you can prevent disease transmission. So they were just a great group of boys, about 25 of them, quite an age range, and I was just so impressed, I guess, especially with some of the younger ones who were just very sort of public-minded and really integrating these kind of complex ideas very well. So and as I said, we talked about some things that the health department does, that state government does, federal government does, the Centers for Disease Control, a local board of health, and how all these different entities work together. So I think it was a really, really great session.
Well, first, thank you for doing that. I think it's nothing's more important than educating the youth on some of these key issues. So I appreciate you doing that, and it's great to hear that they were receptive and that worked out. Larry, I was reviewing this material that you had sent out earlier, and one of the things that struck me was about educating folks on some of the environmental issues, especially related to pesticide products and labels, and how to deal with. And then I thought about some of even the chemical cleaning agents that people have in their homes, as well as simple things like batteries. Do we have a resource that helps people understand how to properly dispose of these types of products?
Yes, I can put a link on the website. There are some resources. I can grab some links and put on our website for people to.
I think, for one, I think that would be a great thing. I don't know about the folks on the committee, but I think that, most people's hearts are in the right place, that they want to do what's right. It's just having the information, especially with things like, batteries and household items like that, I think would be very helpful for folks.
And even computer monitors and other items like that, I think would be good too.
Absolutely, absolutely.
Mark, I can comment on that, at least from a hazardous waste collection standpoint. The county runs a series of collections throughout the year. The closest collection point is the Haverford Marple transfer station, located in the industrial complex in Broomall. They collect everything from paints to household chemicals, batteries, and such. And I think we've done a pretty good job of promoting that from the township standpoint, but I think what I'd like to see is try to bring that collection into Radnor and have a transfer of these types of waste, have a collection site here and then have it taken to their site so that we can get a better level of collections. I don't know if we have any. I'll try to get statistics on how well we're collecting in Radnor's in terms of this waste. But I know that when I go to the site, I don't really see too many people from Radnor there. And I have a feeling it's just a convenience issue. And I think if we could somehow do a collection in Township, it might boost the collection rates and boost awareness. And it's just personally, I keep like Ziploc bags in my closet with CFL bulbs and batteries and whatnot, and we keep them there all year round. And when they're full, I take them over to the collection site. But it's something that we have to promote and kind of give ideas out of how to do that best.
John, did this used to be different, or maybe Larry, you know this, because when I moved to the township 15 years ago, there were some paints left from the previous owner, and I remember I came to the township building and arranged a pickup, because I remember putting them all out in my, driveway, and somebody from the township came and picked them all up, so.
Yeah, we do have some procedures in place. I'm just not certain what they all are. That's why I didn't want to misspeak. But I want to get that information together.
Having just done that, I do know what the procedure is. You can call the township and depending on what your next trash day is, they'll ask you to put up to 4 paint cans in a box. And if you have more than 4, obviously you have to start a second box, but they'll schedule a special pickup on the same day as your regular trash day.
Great. Well, Larry, as you follow up on that, perhaps we get that information, and then Herb, perhaps this is something that we can coordinate with the EAC to make sure that we're not overstepping our boundaries here. It's just, as I was reading the information from the National Association of Boards of Health, just kind of struck me as something that'd be a key for the community to know. Any other business? Hearing none, appreciate everyone's participation, and the meeting is adjourned.